we've had to do at our institution, what we've chosen to do at our institution, is really take that subject interaction and use it as a training tool. So we've gone as far as to have subject participant panels come in and do noontime lectures. This was my understanding of being in a research project, or a couple of them, I didn't know I was in a research project. You know, that's a big gap. That's a big barrier. Well, what could have been done differently? How could we learn from that? Doing those panels, having them involved, is really that eye-opening experience in some ways for our investigators and our research community at large. Having them, the subjects, involved in our consent training process. A couple of subjects or a couple of volunteers from our community every year come in, and we have our new investigators practice, how do I conduct consent, and give me feedback on that process. That is not something I can say we see done everywhere, but that's an approach we've decided to take with some of the barriers we have with our community in language or economics. And that training tool has been a significant help for us, especially with some of the newer people, my staff included. It's also giving a voice to that research community and the research subjects in our community, in that they're able to be involved in the process. It's not just, let me be that patient that is serving as your guinea pig, trying to see, will this work, will it not work? They're also going to be a part of that process. I'm helping train. I'm helping learn more about this. I'm helping to facilitate your learning and moving this research forward and making it better for the next person. We have a noontime lecture series that we try to do at least 5 to 6 times a year with our research community. Part of that is so that our coordinators and others can earn credits to keep up certifications, because we require that our research staff be certified, SOCRA certified, or another certification, ACRP, Primer, the CIP certifications. We try to make sure that we're building a little bit of an educational program that will help assist with that. And we were looking at our numbers and things and trying to see, okay, how are we doing, what subjects are of interest to our research population, and that's where we kind of came to, we need something different. We need something that's going to reach out, try to bring in more of a crowd. What's something we haven't done before? And so I have 2 education and compliance coordinators under our Human Research Protection Program who put their heads together, and we kind of said, okay, what can we do? So I have to give Judy Pride, one of our integrity coordinators, really a big component of that. She said, well, what if we do something like this? And this is where we started to build this. And so we reached out to our patient advisory panel, the person who leads that, and tried to see what we could do to build this. We reached out to different researchers as well and said, do you have a subject who would be interested in talking to us a little bit, giving us their experience? The response from our investigators has been very positive. It's been rated as one of our highest programs that they've wanted to take an interest in and be present for. Let's face it, they're all very, very busy. With all of the changes, there's a big push from the hospitals to make sure they're meeting their requirements for seeing the patients, and there's a big push from our community to be sure they're getting in a timely manner. So for them to take such an interest and want to make sure they've got the time available, really sent forth the message to us. This was something that was important to them too, and that's why we really wanted to move this forward. So it's been beneficial to all parties. You know, we're not perfect. We're not doing everything as the best possible manner that we could, is what we're learning from this, but we're taking that and trying to build upon it to make it something even better.